Hi, everyone. This is Janet Hill at the Rock Island County Health Department. Thank you for joining us, and sorry for the slight delay in getting started. Today, we have 3 physicians and 2 public health officials talking about the recent surge in cases. First of all, we'll hear from Dr. Ludwig Katz. He's the medical director of the Scott County Health Department. Then we'll hear from Dr. Christopher Crome. He is the vice president of medical affairs at Genesis Health System. Then Dr. Olutade, he's the chief medical officer at UnityPoint Health-Quad Cities. And then Nita Ludwig, Rock Island County Health Department administrator, and Amy Thoreson, director of the Scott County Health Department. Let's start off, please, with Dr. Katz. Thank you.
Hello, thanks for being on. Brooke, are you gonna share the curves? Good. Okay, well, this is Scott County's epidemic curve. Rock Island County's is the same shape. The numbers are a hair different, but not much. This is since the 1st of July, when we were really doing very, very well prior to the Delta surge. So we just passed 50 cases per 100,000 per day, and the test positive rate is 14%. That's the bad news. And you'll hear a little bit more not so good news from my hospital colleagues when they talk about what's going on in the inpatient units. Brooke, are you going to show the aggregate curve? Yeah. So this is the curve since the first cases in the Quad Cities in mid-late March of 2020. And it shows you where we were in the fall last year in comparison to now. So the good news is we're not really near the worst that we saw. The bad news being that we're climbing, and I expect we'll continue to climb through the holidays and probably into January. The number of infections in the face of vaccination is of somewhat less interest than what's going on in the hospitals in terms of the resources available to take care of sick people. So we wanted to give most of the time today to the hospital people to talk about what they're seeing, and I'll hand it over now.
Thank you.
First, Dr. Crome with Genesis Health System. Thank you.
Yeah, thank you. We've been seeing an increase in COVID cases in our hospitals over the last few weeks. And that probably is related to people being around each other unmasked and unvaccinated. Certainly now, a few weeks post-Thanksgiving, our cases are rising in the hospitals, and our percentage of critically ill patients who are being admitted is much higher than it has been. Currently at Genesis East in Davenport, we have 20 patients in our ICU, of which 16 have been positive for COVID or considered COVID recovered, of which a very high percentage of those are currently on a ventilator. And in total, we have about 56 cases at Genesis East, which are COVID positive. The difference between last year and this year is last year, largely, our hospital systems were focused on managing COVID patients. We did not have a high census of other types of illnesses, and we were not doing the surgical volumes that we are doing now. So unfortunately, from a census standpoint and from a bed availability standpoint, we are at a critical point compared to where we were last year. And the ability to pull resources from other areas is compromised. Last year, if you had surgical volumes being much lower, you could pull resources from other areas to shore up our areas where we're tight. Currently, we're struggling with that. And it's led to a point where we are having patients waiting in our emergency departments for admission, not only to the ICU, but also to our medical and surgical floors. This has led us to change our process in which we manage these patients in the emergency department, and it's not optimal. And I guess to go back to what we've been telling people, because a high percentage of our critically ill are unvaccinated, Still, the keys are to get vaccinated because it will lower your risk of getting critically ill. And if you are ill and need to be evaluated, first start with your primary care provider, or if you don't have a primary care provider, a non-emergency department location to be evaluated. As of now, we've had wait times of over 3 hours in our emergency departments. And for non-critically ill patients, that's probably not our best choice for you to come to those locations, but better served to be evaluated by your primary care provider, and then determine if you need further evaluation in our emergency departments.
Thank you so much, Dr. Crome. Are you able to tell us anything about the rate of vaccinations in the ICU? Dr. Katz was curious to add that information as well.
Yeah, currently of our 16 patients that have been COVID positive or are considered COVID recovered, 15 are unvaccinated, so only 1 was vaccinated. And historically, we've been somewhere in the neighborhood of 80 to 90% that have been unvaccinated who are admitted to our other floors, non-ICU admissions.
Thank you for that information. Next, we'll move to Dr. Olutade from UnityPoint Health Trinity. Thank you for being here, Doctor.
Yeah, thank you, Brooke, and thank you, Dr. Crome and Dr. Katz, for your comments. What we're seeing right now is actually more challenging than I would say the previous peaks we've seen. As Dr. Crome mentioned, we had the ability at that time to suspend some of the other procedural cases. However, what we're seeing is not just high COVID numbers, but non-COVID cases are also very high and very high complexity of patients and acuity of patients. I would say that November 18th, which is not quite about 3 weeks ago, we had 26 patients with COVID-19 in our facilities in the Quad Cities region. And right now we have 81 patients. So that's more than tripled. And just last week, I was talking about a 50% increase. Really, it's accelerated since then. So, and we know that many of these patients, they do not just come in and leave. They stay for quite a while in the hospital. And out of those 80 patients, we do have about 17, 18 in the intensive care unit. And now the percentage of vaccinated overall that are having breakthrough infections, it hovers around 20%. So 80% of the patients that we have are not vaccinated. And I would say that just to add more commentary to that, we have barely seen probably any patient that has received a booster that is coming in. Probably 1 patient we've seen that has received a booster and still critically ill with COVID-19. So overall, that's where we are. It's a rapid it's a quick surge. It wasn't just a steady surge. It just went up exponentially, and that's what we're seeing. And I would add that wait times in the ED, you would expect that to be unfortunately high right now because every bed is occupied, and we're doing our best to prevent, reduce admissions and reduce the critically ill patients coming in. But you know, early diagnosis of COVID-19 is also critical to this. So if you have symptoms of COVID-19, you need to get tested early so that you can avail yourself to things like monoclonal antibodies, which are one of the means to reduce severe disease. So, and we're working on that. We have, I would say right now we have about 100 requests for today pending for us to fulfill for monoclonal antibodies, which is, it's a good way to prevent hospitalizations. And we're also redesigning our care, allowing people to go home with home oxygen, with a way to monitor their oxygen levels at home as well. So those are the ways we're redesigning care. Our urgent cares are very busy. Our express cares are very busy. So it's busy everywhere. So, and as Dr. Crome mentioned, there's resources there what we have. Yes, we're better prepared in terms of PPE and supplies, and we have good we understand the therapeutic agents we're using. However, the hospital systems are quite overwhelmed and inundated with the high number of patients at this time.
Thank you so much. We're going to hear a little bit more from our public health department. So next we'll hear from Nita Ludwig with Rock Island County. Thank you.
Hi, so as you have heard, physicians and public health officials across the country and here locally have stressed that the overwhelming majority of people who are seriously ill or who have died from COVID-19 are those that have not been vaccinated. Dr. Fauci called this a pandemic of the unvaccinated. So I decided to look at our recent numbers to prove that the same is true in Rock Island County, and not surprisingly, it is. Looking up the vaccination status of every patient is very time consuming. It took roughly 4 hours, and it's not something that we can do often at this time. Of the 219 recent positive cases from over the past weekend, 181 of them were not vaccinated. 3 of them were partially vaccinated, meaning they had 1 dose of a 2-dose series. And 35 were vaccinated, but only 2 of those had had a booster shot. So we are seeing that boosters can really be useful, and we're really encouraging everyone that's eligible to get a booster, get that done. Because of the high levels of virus, again, circulating in all regions of the country, and particularly here in the Quad Cities. The same is true for deaths in Rock Island County. From November 1st to December 6th, we reported 17 total deaths, and not surprisingly, most of those were not fully vaccinated. 11 of them were not vaccinated at all, which is 64.7%. 2 of them were partially vaccinated, so only had 1 dose at that time. And then 4 were vaccinated. But of those 4 that were vaccinated, they also had serious underlying medical conditions, which probably contributed to succumbing to COVID-19. This little study just proves what we and other public health officials and healthcare leaders have been saying for months, and for the hundreds of years, really. Vaccines work. Please get vaccinated as soon as possible. Visit vaccines.gov to find your shot. Rock Island County Health Department offers walk-in vaccination clinics from 9 to noon and 1 to 4 on Tuesdays and Fridays. And boosters and 3rd doses for the immune suppressed persons in our community are also available on those same days, as well as 1st or 2nd doses. We offer vaccines for children 5 to 11 by appointment on Fridays. Pediatric clinics are full right now, but the next opportunity to sign up will be December 15th. That will be through our Facebook page and a Sign Up Genius link. And the clinic date is December 17th. So the sign up will go on the 15th for the clinic that will be held on the 17th for 5 to 11. Many of our healthcare and pharmacy partners are also offering vaccines as well, and also with those kids age 5 to 11. You can also find their vaccines on vaccines.gov. While we are in this high wave of the virus transmission, and we must also continue masking and social distancing. A mandate from Illinois Governor Pritzker requires that everyone over the age of 2 to wear a mask when in indoor public spaces, regardless of their vaccination status. The CDC also recommends that everyone 2 and older wear a mask in counties with high or substantial transmission, which we have been in for several months. We also look forward to the day when vaccination rates are high enough that we don't have to wear the masks in public and when we are around unvaccinated people. And this day will come. And this is good public health advice for COVID-19 and any respiratory disease, especially during cold and flu season. Stay at home if you are sick and wash your hands frequently. Thank you very much.
Thank you, Nita. And lastly, we'll hear from Amy Thoreson, the director with Scott County Health Department.
As we've heard from our health system partners, we are at the most challenging time in this pandemic in the last year, since the surge that took place last November. Fatigued isn't a strong enough word for the sentiment in our community right now. Nearly 2 years of vigilance, being told what to do, and having to change your activities is exhausting. We know that we have to live with this virus, which isn't going anywhere, and we can do that as a community. But living with this virus doesn't mean doing nothing. To put it into perspective, we live with the dramatic changes of weather in Iowa, but we make decisions and take varied actions as necessary depending on the weather. The weather has changed and now it's cold. I change my actions by wearing a winter coat, gloves, and hat if needed. We are not new to this concept of having to change our actions based upon the circumstances before us. The landscape of the pandemic has changed. Cases were lower in previous months, and many of us had opportunities to take part in activities while not worrying as much about COVID risk due to events being held outside and case counts being lower. The COVID situation has changed. The case counts are high, hospital systems are strapped, and there is no immediate end in sight. We need to change our actions as we do for everything else we encounter. For this, it means masking even if you're fully vaccinated. It means getting tested when your symptoms feel just like a common cold or what you think is your allergies. It means staying home if you suspect any of these symptoms. No meal or family event is worth learning later that you put your grandma, your niece, or your cousin battling cancer at risk due to now being COVID positive. This won't last forever. This pandemic will ebb and flow, but we're in a tight spot at the moment and we need to respond accordingly. Just know you're not alone and we're working together to respond to this pandemic.
Thank you, Amy. Appreciate that. We do have a couple of questions that have come in through the chat, so I will go ahead and go through those and see if we can provide some responses. Nita, the first question is for you. We know that in Test Iowa, we have test kits that are being made available through various community places such as the health department. Is Rock Island County or the state of Illinois have any plans to do any testing closer in the area such as that?
At this time, we have not heard of that. We do have testing at all our local pharmacy partners, and some of the health systems, of course, have testing available. You know, the president has said that more tests will be available soon, but we haven't heard anything directly from the state yet.
Great, thank you. And I believe in the chat, there's been some question and responses related to the Omicron variant and how the current surges that we're seeing is really still related to Delta as the primary variant in our area as well as across the nation. Dr. Crome, perhaps you can just reiterate what this surge and how it's different than what we've previously had for challenges.
So although our total number of cases are not as high as they were last November of 2020, the number of cases that are critically ill is quite similar. And that's being combined with having high volumes of other types of illnesses and normal surgical volumes that a busy hospital would have otherwise. So you run into situations where not only are you trying to find actual rooms for patients to be in, we still are struggling with having enough staff to manage our volumes on top of that. We've been working with the state of Iowa to obtain traveler nurses to help shore up our ICUs and emergency room departments. And those things are different than they were last year. Last year, we had the resources still available because they weren't being taxed in all our other areas to recruit from. We don't have that currently.
Dr. O, anything you'd like to add to that just to make sure the community understands the additional challenges we're facing right now?
Yes, the additional challenges are related to the fact that, yes, last year at our peak were about 116 patients with COVID-19, and then right now, as of today, it's about in the 80s. The challenges that we have many other non-COVID illness and a lot of people that are ill from non-COVID disease. So it's not just that we have our beds occupied by COVID-19 patients, but we also have critically ill patients with heart attack, strokes, with bowel obstructions, with fractures that all need care and need care right now. And so when you combine the severity of illness of non-COVID diseases, and you add on the COVID-19 surge, and that is what is making it tasking, because you cannot really pull back resources from surgery, because there are people that need surgery today. You cannot pull back resources from the clinics, because we need patients to be seen in the clinics. Clinics are very busy. The urgent cares are busy. So overall, there's a lot of illness around, not just COVID-19, but there's also non-COVID-19 related disease, and the level is quite high. So based on that, and you can add on 18 months, 20 months of this, of course, that is a strain. However, it's just the sheer number of ill people, not just COVID-19 related, but other diseases as well.
Thank you. That helps to give some perspective there. And could you speak to, in terms of the individuals who have such severe illness right now from COVID, do you see that people are failing to go to the doctor early enough, or would other early treatments have prevented hospital admissions? I know you were mentioning some of the things you're trying to do now to prevent people from ever needing to enter the hospital, but what are you seeing with those current patients?
For some of these patients, some of them have waited a little bit before getting tested. They're getting tested or going to get checked out day 5, day 6. They stay at home for the first few days and attributing it to common cold or allergies. So early testing has been an opportunity. And the second piece of it is that even when they get tested positive, they test positive, the next step, we offer monoclonal antibodies to a lot of the patients. And some have been hesitant to receive that, and unfortunately end up in the hospital, critically ill. So it's the early testing, when the symptoms arise, that's number one. Number two, after testing positive, you need to avail yourselves to the monoclonal antibodies. That is going to be very huge. That's huge. I know there are some pills that are right now undergoing FDA approval for prevention of severe illness. That would also help when they become available. But this time it's really early testing, early diagnosis, so that you can initiate care and treatment early enough before things go south.
So as individuals, we have many more tools at our disposal now with masks and vaccines and all of these things to hopefully help to work in our favor. Nita, a question for you, since your agency is still doing contact tracing, are you hearing anything anecdotally if it's helping to prevent spread in the community?
I don't think I have any magic answers to that with contact tracing. Of course, people are indoors more. We have, school kids, they're indoors all day long with each other. And of course, Thanksgiving now is probably contributing to some of our numbers as well.
Thank you. And then Dr. Crome, I'll just look at you speak out loud to whether or not individuals are having to be transferred to other facilities due to just capacity constraints that we're under right now.
Yeah, we've had patients in our emergency departments that are critically ill that need an ICU bed that we've had to transfer to get them the care they need. That's been not a common practice, thankfully, but should we continue to have a surge of COVID admissions and critically ill COVID admissions, it could be a more common practice. We are working on trying to expand our resources to take care of these critically ill patients, but we are having some challenges with both staff and bed availability.
Dr. O, are you seeing similar issues on your campus as well?
Yes, absolutely. That's what we're seeing, and just to add more to that, not only do we attempt to transfer them, when we reach out, we call out as far as Ames, as Chicago, go south, anywhere. I mean, it is not just unique to us. When you call the University of Iowa, I can tell you that their wait times about 2 days or thereabout. And not just that, you reach out to OSF Peoria, reach out to Methodist, to Mercy Hospital. So all the hospitals are quite very, very busy with all these patients. So it's very challenging to even transfer the critically ill patients. Yes, they do triage and make room for some that are just super critically ill, but we've had to manage some of these patients in our emergency departments until we get some room in the inn for them. And Furthermore, we have outlined critical access hospitals, or smaller hospitals that would oftentimes transfer care to a hospital. They've not been able to accept a lot of patients from them. So they've also had to innovate, to be innovative where they are locally to provide care there. So it's you can see the ripple effect. It's not just us. We cannot transfer to higher level of care. Other places cannot transfer to us where they've traditionally done that.
So we do have a follow-up question about the wait times in the ER, and I know you just mentioned something about making sure that there's room in the inn to transfer patients from the ER up. But can you speak a little bit more to that about what that looks like when our ERs get overwhelmed, such as this, and we have those multiple hour wait times?
So what we really want to ensure is that those that need the care the most really get the care immediately. Unfortunately, when the ER is very backed up for an hour or two and people have to wait, the danger is that there are some conditions that cannot wait for 2 hours or 3 hours, or they get worse. So what we've been doing is really to look at how can we can even doubling up rooms right now on the medical floors so that we can decongest the emergency department. We're working with agencies to get additional staffing, travel agencies, and also with the state. We're working to see if we can get any resources from the state and emergency medicine services. Furthermore, we have we know that we have to curtail a lot of our elective cases, and that is being done every day. We're looking at all surgery cases that have been scheduled, and to ensure that the acuity that they really need to be done right now, rather than taking up a bed for another sicker patient. So we are doing that and making adjustments on a daily basis and looking at that. We also we know that we may need to expand our ICU capacity because patients are that sick. So we're putting all that plan in place. We've had a experience last year, and we can do some of the things we did last year, although this year it's a little more challenging because it's just very busy across the board.
Thank you. One question was in there more probably directed towards public health, and if we're happy with the vaccination rates among young children. I know we're still looking at some of that data to be coming through soon, because those initial children are probably just getting to that point of the 2 weeks past their full immunization. And that's when that data will start coming in. So I suspect we'll have some of that to share at our next briefing. And then final question, Dr. Crome, I'll just let you answer this verbally. And it was related to those plans of expecting to have to continue surge planning and implementing those plans. So can you describe what systems such as yours do in these circumstances?
Well, as mentioned earlier, we do have experience adjusting our staff and adjusting our service lines to accommodate the extra volumes. We're currently looking at limiting our surgical volumes to allow us to have more beds. Those beds would be available because often patients need to stay for a day or two after a planned procedure. So choosing to postpone things that are not urgent, that would not result in any harm to a patient, is an option. Expanding our ICU, and we're at our limit in our traditional ICU just from a room perspective, but we have, like I said earlier, we have gotten some travel ICU nurses from the state of Iowa that they've obtained for us to be used for the next 60 days. And that would allow us to have staffing to meet that demand and use other parts of our hospital to act as an ICU. We have used rooms and doubling those rooms up on a COVID unit. We haven't resorted to that yet, but that could be a possibility. Part of what happens in the next week will help to decide whether we need to push for those changes. In a lot of what happens in the next couple weeks could be dependent on our community and how they respond and how they behave as far as wearing a mask and avoiding large groups, and if they're not vaccinated, get vaccinated. So hopefully our community helps us out.
Well, thank you all so much for participating in this important messaging event for our community. We're grateful for our media partners on the call for sharing this information. We do need your assistance in getting this out. We need our community to understand where we're at in terms of our capacity and ability to respond, and asking them to take the appropriate measures that they need to at this point in the pandemic. We have recorded this briefing. We will be posting it on our webpage as well as on our Facebook pages to continue to share that, as well as with community partners. Thank you to Dr. Crome. Thank you to Dr. Olutade and Nita, Amy, and Dr. Katz as well. We're grateful for your guidance and continued work throughout these challenging times. Thank you everyone for being here. Have a great afternoon.
Thank you.